Let's bring it back home now. Gauteng is continuing its battle against the third wave, and the province accounts for 66% of the country's infections, thus placing quite a strain on hospitals. But now there may be some relief as parts of the Charlotte Maxeke Hospital reopen. It was previously closed after a fire had broke out in April. And our reporter Maxeke Hospital joins us now with the very latest. Good morning to you, colleague. I suppose some bit of relief, for those who work at Charlotte Maxeke, but also the patients who rely on the hospital for medical services. What do we know at this stage?
Definitely a relief, Dumelo, especially for the province of Gauteng, which is recording the highest number of COVID-19 infections on a daily basis. So the reopening of some sections of the Charlotte Maxeke Hospital after a 2-month closure after that fire in April is really a relief. If you look, one of the most important things that was spoken about, and my colleague Debogo Masilo is showing you there, the radiation and oncology department were really a huge concern, especially in terms of the pressure that had, that had to be taken to hospitals that were then asked to assist with patients from Charlotte Maxeke. For instance, your Chris Hani Baragwanath Hospital in Soweto, as well as Steve Biko Hospital in the city of Tshwane. There was also that issue about where patients would travel. If, for instance, you are living as far as Midrand and you're expected to travel all the way to Bara in Soweto for treatment. So this is really a huge relief for the province of Gauteng. As you know, Charlotte Maxeke was among the five first hospitals that were named as hospitals that were meant to deal with COVID-19 when the epidemic arrived here in South Africa around March last year. So this is really a huge relief, and it shows you just how important this hospital is. If you listen to what the president said yesterday in terms of hospital beds, we know how full hospital beds are in both the private and public sector. There's been complaints there about how many patients are being treated, how many patients need ventilation and oxygen, etc. And the president saying that the closure of Charlotte Maxeke actually contributed to the suffering of that part, in terms of healing people with COVID-19 and even other patients. So this is very important. And here's the president, as he was addressing the nation yesterday about us moving to alert level 4, talking specifically about this hospital and the reopening of some of the sections.
In Gauteng, the loss of significant capacity due to the ongoing closure of the Charlotte Maxeke Hospital is adding strain to our other hospitals. We are doing everything we can to provide additional bed capacity and speed up the reopening of Charlotte Maxeke. At present, Gauteng has made available 830 additional beds by postponing elective surgery and another 400 beds constructed with alternative building technology that are now being activated.
And Maxeke, with that being said, just hearing the president there, have we heard already from, or are we likely to hear from Charlotte Maxeke, just in terms of that capacity that the president refers to, bed capacity, resources, making sure there's enough just to assist healthcare workers, to assist patients in dealing with this third wave?
Well, we did get a chance to see the hospital CEO, Gladys Bohoshi, a little earlier on, in fact, just a short while ago, but she is inside getting a brief from staff members, including, for instance, the head of department, in terms of how things have been going since the reopening of the hospital this morning. But I do have with me Gwara Kaikana, the spokesperson of the Gauteng Health Department. Gwara, good news, of course, that Charlotte Maxeke is reopening today. Just explain to us, and for the viewers, especially those who use the services of Charlotte Maxeke, exactly which sections will be reopening today, which services will they be able to start getting from today?
Sure. Good morning to you, Maxeke, and good morning to the viewers at home. You're quite right. I think both as Team Gauteng Health, we're quite excited about the developments today. But I think in particular as well, the kind of relief that the radiation oncology patients will be getting in terms of receiving services. And we can confirm that as of this morning, we have already started receiving and treating patients with regards to the oncology unit at this facility. So that's is quite positive in terms of that patient, but also from our side as well. I think the most important thing, and this is what the provincial government has been reiterating throughout the conversations around reopening Charlotte Maxeke, that it is going to happen in a staggered approach. So one of the areas that we're going to be focusing in addition to radiation oncology is going to be looking at reactivating services as it relates to renal dialysis, critical maternity patients, as well as critical COVID-19 patients. I think, the most important thing, Masego, I think for our viewers to note is that the emergency department is not yet open, and as a result will not be taking in walk-in patients. So we do advise our communities that they shouldn't make their way to the hospital if they require urgent medical attention in the hopes that they'll get access to the emergency department as yet. So we'll be communicating when that is then, that service is reactivated. Once again, I think the most important thing as well is the collection of medication of our patients. They have been using our sister facilities to collect medication. We continue to advise them to do that until such a time that we are able to communicate that our pharmacy has been activated and is up and running, is able to then take back those patients and start servicing them. So we really don't want to create a situation where patients come here and we're not able to service them. So we really ask them to please just continue to be patient with us as we continue to reactivate the hospital in a staggered approach.
When we talk about the emergency section still being closed and COVID-19 patients, what happens in terms of patients who probably start experiencing, those really severe COVID-19 symptoms? Can they come to Charlotte Maxeke?
So the most important thing is that I think if people are experiencing, and they need, urgent medical attention, we advise them to call 112 or 10177. That's our emergency medical services line. And the Gauteng Emergency Medical Services team will then respond and then take patients to the appropriate level of care for treating facilities in the province. Like I said, the most important thing for us is to not create expectations that we're not able to meet as a department. So the emergency department is not open as yet, and we'll be able to communicate. So 112 becomes the go-to number in terms of any emergency or urgent medical attention that could be required, even outside of COVID-19 patients. So they will then be treated at other facilities. But the move, again, Masego, would be that we want to also focus in terms of the staggered approach on critical COVID-19 patients. You'd remember that at the start of the pandemic, Charlotte Maxeke has really been the go-to facility in terms of COVID-19 treatment, and I would also imagine just in terms of COVID-19 protocols. So that would be the focus. But of course, I think we'll communicate as we have been doing as the days go by in terms of what we're able to offer for both patients and staff.
Okay, so just simply put, so that I understand, are there any beds available for COVID-19 patients at Charlotte Maxeke?
Remember, Masego, Charlotte Maxeke has over a capacity of over 1,000 bed capacity as a facility, and I think out of that, Charlotte Maxeke had over just 400 dedicated COVID-19 beds, different categories of beds, I would imagine, dedicated for COVID-19 maternity, pediatrics, you name it. So those beds, are there, but the issue is about, one, safety in terms of where we would treat COVID-19 patients, but also just in terms of, what we're able to do from both the human resource side and just what the building itself is allowing, quote unquote, for us to do. So that becomes quite important, and I think that we'll then be able to communicate to the public and of course within the health system as well, how we'll then be managing COVID-19 patients as and when they come to this facility. But the most important thing is that the emergency unit is not open. People shouldn't do walk-ins as a response to perhaps needing urgent COVID-19 attention. Sure.
Thank you very much for your time. Well, Dumelo, as you heard, you can't come to Charlotte Maxeke if you're needing urgent medical attention yet, and that would include patients or people who are experiencing severe symptoms of COVID-19. You can't come to Charlotte Maxeke just yet, but soon enough, as you heard with the president saying, they're hoping that those services will come out very soon. 400 beds, Dumelo, for those COVID-19 patients specifically, that would be a huge relief for a province such as Gauteng that is experiencing the third wave at its worst.
Indeed, colleague, quite important to manage those expectations. Thank you so much, Masego, outside the Charlotte Maxeke Hospital.